I'm Cynthia Newsom here at Lee Summit Medical Center in the patient rehab lab, along with Dr. Matt Daggett, who is a board-certified orthopedic surgeon. We're talking about women and sports injuries. And Dr. Daggett, This is the time of year when we really are seeing more women with sports injuries. What's going on?
Yeah, quite a bit. So part of it is seasonal. Obviously, the weather's nicer. People are getting out more, being more active. The other part is for younger female athletes. A lot of the female sports are starting. You see a lot of female soccer injuries, softball injuries.
Let's talk about one of the number one injuries that women are experiencing, and that's the ACL. What's happening with the ACLs? Is it tears? What's going on?
Yeah, unfortunately, female athletes are at a much higher chance of ACL injury than male athletes, and the reason is really multifactorial. Part of it is the female anatomy is just a little bit different than the male anatomy, and just the ratios of the hips provide a little bit more stress on the knees and puts a little bit more force on the ACL. Traditionally, in an ACL injury, the knee is suffers a non-contact injury, so there's usually no collision, and the knee actually rotates, and it causes the two bones, the femur and the tibia, to shift. That, unfortunately, those forces cause disruption of the ACL, which is right here in the inside part of the knee. The ACL is a stabilizer of the knee. It protects the knee, and it controls both the bottom bone moving to the front as well as a little bit to the side. And the issue with ACL injuries is they're not all the same. Every ACL injury has a little bit different injury pattern. Different structures can get injured, and the important thing for treatment is identifying what those other injuries are so that you can maximize the patient's treatment. What you see here is with this white substance here is that's fluid inside the knee. The most common thing that appears immediately after ACL injury is the knee gets very swollen. And that's because there's an artery on the inside part of the ACL that becomes damaged at that time, causing that swelling pretty much immediately. So our goal with ACL reconstruction or addressing ACL is to maximize our return to activity in sport and minimize our chance of re-injury.
What's your best advice for women that are out there playing sports, engaging in activities, weekend or, full-time career sports?
Yeah, unfortunately, our healthcare system is very reactionary. And it's very important that we focus a lot on prevention because it's a heck of a lot more easy to prevent injury than to treat it, right? So really identifying any movement deficiencies before you get back into activity, either by a trained sports rehab specialist, physical therapist, athletic trainer. I look at musculoskeletal care as a life cycle, prevention, wellness, injury, and intervention. And we obviously want to focus more on the prevention and wellness side, but after you get hurt and you recover, it's very important to progress yourself back into activity, not just jump full go.
And that's one of the things that they have here, the patient rehab lab here at Lee Summit Medical Center, where patients can come and get that rehab that they need to get back in shape. I'm Cynthia Newsom, 41 Action News.